All right, we are joined now by Brian O'Connor, chair of the European Connected Health Alliance here at the ATA. So our goal here today, Brian, is to discuss all things ECH. So let's first start off with the mission of the organization.
So it can be summed up by saying we are the connector, because we discovered 10 years ago when I started this that lots of people who should know each other don't. They know of each other, they read other people's notes or papers, but they don't actually interact, and therefore they don't actually connect the dots. And therefore we brought in many organizations are to do only with industry or with research institutes or governments. We decided we weren't going to do that. We were going to have everybody in the one tent. And literally that's what we've done over the last 10 years.
Wow. So of course, it's all about collaboration and partnership. So walk us through the Global Connector Alliance and how ATA plays a role in that.
Well, it's interesting, the story of that, because 2 years ago when the pandemic hit, I was sitting at home thinking, what am I going to do? Because I'm not going to be able to travel. And I traveled every week. And I knew I'd get bored very quickly. So I thought, what I'm going to do is call all the people I know, but on a bilateral basis. I'd worked with Anne and Joe Kavadar here at ATA for many years. I'd worked with people in health. I'd worked with people in India and various other places, but I'd never actually had them all in the one room. So I thought, I'm just going to call them and see if we could convene a meeting. So we called a meeting and I invited them. I didn't know if they would turn up, but they did. And the meeting was 1 hour long, because we capped it at 1 hour, because they're all busy. And I said, tell us who you are, what do you do, where do you do it, and what are you going to do next? And they went, okay. So we went round the table. When that was over, everybody went, this is a good idea, we should do this again. And I said, I'm not doing it again. Because all we're going to do is meet again to talk about the same things and say we're going to meet again. That's not the purpose. The purpose is decide in the next 30 minutes that's left what we're going to do together. I don't care how simple it is, just do it. So we decided we'd do 90 minutes around the world in 90 minutes, right? So we did that session at ATA last year. We did various other sessions at our partners around the world. And that meant you could bring speakers from Africa, from India, from Latin America, from Europe, from the US, right? Australia, etc., in the one room, albeit virtual at that time. And that was the beginning of a relationship. And ATA are a crucial part of that. We've known them for many years. We know their mission. We know what they want to do. And it seems we could amplify that mission. We don't want to do what they do. We want to amplify what they do and connect them to other parts of the world.
Yeah, and it's truly amazing what happens when minds meet in person, right? This is how this beautiful partnership all came about, to your point. So, of course, now we're here this week in Boston for ATA 2022. And what can we expect between the ECH and ATA's continued collaboration?
A lot more. And specific things. We've already agreed with Anne in the last day or two, before even the conference started, missions of 3 themes that we're looking at together and around the globe. Because it's interesting, every country's got its own way of doing things. America has, certainly influenced by reimbursement and regulations and so on, and a very complex, which I've never fully understood, complex healthcare system here. But then you look at Africa, 21 African countries who are members of our organization. You look at India, a vast country with huge. They all do things differently, but they all suffer from the same issues. For example, how do you recruit people? How do you train people in the workforce? How do you inform citizens how to use the digital skills? So that's a global thing. It's not just American or anywhere else. Then we looked at disparities. There's huge disparities throughout the world. Here in the States, India, you just go around the world, same issue. And then the next one was, how do you actually solve some of those problems? And you do it by connecting the dots, by taking digital and data and using that as a bedrock, as a foundation to actually transform those shortages of skills, but also to empower citizens. And it was interesting, it wasn't difficult to agree the mission, strangely enough. It wasn't like you had to sit and persuade people. Everybody went, yeah, we do that as well. Well, why don't we do it together? Focus in your own country, yes, but have a global view. So you lift your head up and you think, I'm going to do this everywhere. And now we have got an infrastructure which allows us to do it everywhere. So yes, we have a lot of plans for the future.
Yeah, it's incredible how many parallels there are, regardless of where you're located in the world in this space. So wonderful work that's being done. And what's on the horizon? So, there are a lot of conversations that will start here, continue the conversations from past years, of course. But then how do we ensure that we have tangible action items that we take with us into the future?
You sound very like Anne Mon Johnson, who runs the ATA.
Thank you.
So what are we going to do
compliment.
next?
Yes, exactly.
So we've agreed. Specifically, ATA have got a fantastic understanding of telehealth. Obviously, the use of telehealth was accelerated during COVID. Now what we're going to do is build on that infrastructure and say, what can we put on top of that to maintain the acceleration, to use it more for the individual patient? So things like mental health apps, other APIs you can put on top of that. So you always should take what exists. It's easier, frankly, in most cases, to change what exists and improve it than to start from scratch. So I want to take what Anne and the team are doing here and use that worldwide. We've already, for example, started to introduce some of the mission of ATA into Africa, where again, they suffer from things like huge countries, rural populations, etc. There are villages which are 4 hours walk, for example, for someone to walk in to see a doctor for 10 minutes. There was a huge maternal deaths, there was lots of deaths in pregnancies and so on, because if a woman has to walk 8 hours to and from a doctor, it's inevitable there are going to be problems. So what happened? You install in each village an iPad, which becomes the clinic. That is powered by the mobile phone companies who use trickle-down electricity to power that. You then, this is an example in Rwanda, as an example of one of our members. They look at the lady on that test, blood pressure, etc. Say, you're fine, but you need a different type of tablet. They then send the tablet by drone and parachute it into a remote village somewhere in Rwanda. Now, these are the lessons, these are the practical realities where ATA, ourselves and the other partners can actually exchange not just information, but saying, why can't we connect those dots? Why can't we, for example, take the drone technology in Rwanda and bring it into the UK? They're now using the same technology in the UK, in the islands off Scotland, where you can't always reach them because of storms. And you use drones, you don't need to have them travel. You use drones to deliver the medication. These are the practical things that we will do globally. It's a daunting task, but it's fun as well.
It's an important one, and it's incredible what technology can do, and a lot of that technology can be seen right here on the exhibit hall, right?
Yes.
With all of these great companies that are true innovators in this space and will continue to play their role in making an impact in the great work that you're doing within the ECH and beyond. So, Brian, thank you very much for your leadership in this, and we look forward to seeing what's next.
It'll be fun.
Absolutely. So this is a great way to end our segment, this edition of ATA TV, sponsored by Logitech.